Hello, and we now come to one of the highlights of every City Health International Conference, the Alison Chesney and Eddie Killoran Memorial Lecture. Today we're very fortunate to have Dr. Marewa Glover delivering this memorial lecture for us. The introduction was going to be delivered by Alex Wodak. Unfortunately, we've had technical problems, so we're going to have to put up with me reading Alex's words of introduction. I'll start off with how Alex describes himself, which I think is the epitome of modesty. He describes himself as a retired doctor from Sydney, Australia, with a long-standing interest in harm reduction, including tobacco harm reduction. I think many of us would agree that rather undersells his contribution to the field. Moving on with his words. 2020 is, of course, the year of a major plague. The COVID-19 epidemic is why the 2020 City Health International Conference is being held as a virtual meeting rather than having us gather in a fancy hotel. The world has had many plagues over the years, but this is the biggest for a century. Epidemics of infectious diseases, including plagues, have caused a huge toll of deaths and disease amongst Indigenous people in the New World. Many of these infections came from the Old World to the New World. Smoking cigarettes is another pandemic which began in the Old World. It increased spectacularly around a century ago after advances in manufacturing, advertising and marketing. It has also disproportionately affected people in low and middle income countries and Indigenous peoples. Smoking amongst Indigenous people is the subject of the talk you are about to hear. We are fortunate to be able to hear Dr. Marewa Glover, a Maori woman from New Zealand, who has made reducing smoking amongst Indigenous people her life's work. This talk at City Health International's 10th event is in memory of two very inspiring people, Alison Chesney and Eddie Killoran. Unfortunately, I never met either of them, but they certainly made a huge impression on the many people who had the good fortune to meet them or work with them. Alison and Eddie met in 1982. Sadly, they both died of cancer within 6 months of one another in 2006. Alison was 48, Eddie was 54. They were very well known and much loved figures in the drugs field. Alison Chesney and Eddie Killoran were pioneers of harm reduction. Alison had trained as a psychiatric nurse. Eddie had for a time struggled with his own drug problems. Alison and Eddie worked together for a better world, a world where people who wanted and needed help received high quality help without being judged. I am sure you all know John Lennon's words from Imagine. You may say I am a dreamer, but I'm not the only one. Alison and Eddie wanted a world where powerless people like them had some power, a world where powerless people get listened to. These days we talk about nothing about us without us. One of the huge differences between people who support harm reduction and those who resist it is the attitude to nothing about us without us. Harm reduction advocates like Alison and Eddie believe that much more is achieved when the experts and researchers work as equal partners with people with lived experience. The partnership achieves much more than either group trying to work without the other half. That's not the way that harm reduction opponents think. We recently lost another public health hero, Larry Kramer, the New York AIDS activist. We can thank Larry Kramer for doing so much for the notion, nothing about us without us. Our next speaker, Dr. Marewa Glover, is the living embodiment of that notion, nothing about us without us. She is the director of the Centre of Research Excellence, Indigenous Sovereignty and Smoking. She is New Zealand's leading Maori tobacco control researcher. She has over 27 years' experience working on Maori health research projects as an author of over 100 publications. Before establishing a centre in 2018, Dr. Glover was a professor of public health at Massey University in Auckland, New Zealand. Smoking amongst Indigenous people has been till now a pretty neglected area. Marewa is changing that. She is actively researching what works and what doesn't work to reduce smoking-related harm amongst Maori people and amongst Indigenous people in other countries. It is my very great pleasure to provide a virtual welcome to Marewa to this virtual City Health Conference. Thank you.